If you wake up with dry mouth, your body is warning you. Almost nobody knows this. Poor circulation, profound memory loss, and even the grave reality of heart failure. These debilitating health conditions, often perceived as distant threats, can subtly begin with something as seemingly minor and frequently overlooked as a persistent dry mouth upon waking. It is a common morning ritual for many, the gentle stir from sleep, the familiar sensation of a parched mouth, followed by a quick rollover to grab a refreshing glass of water, and then, without a second thought, the start of the day. But what if this pervasive dryness has absolutely nothing to do with simple thirst and everything to do with a critical message your body has been attempting to convey? What if this seemingly innocuous symptom is, in fact, an urgent warning signal, diligently sent for months, perhaps even for years, yet tragically, no one has ever equipped you with the knowledge to interpret its profound meaning? This understanding, once truly grasped, is what consistently compels me to pause and deeply reflect on its implications. The startling truth is that chronic morning dry mouth afflicts a significant portion of the adult population, impacting nearly 1 in 3 individuals over the age of 60. And in the overwhelming majority of these cases, this persistent dryness bears absolutely no relation to the amount of water consumed the evening before. None whatsoever. Despite its widespread prevalence and potential gravity, this crucial conversation remains conspicuously absent in most pharmacies, a topic rarely addressed during routine annual checkups with primary care physicians. It is, quite simply, a vital dialogue that is profoundly and consistently not being had. I urge you to remain engaged and follow this discussion through to its very conclusion, because the primary cause I am prepared to unveil today is likely something silently residing in your medicine cabinet or perched on your nightstand at this very moment. This seemingly benign item, taken without a second thought, may be inflicting far more extensive damage than merely desiccating your oral cavity. We are delving into a matter with the alarming potential to simultaneously compromise the well-being of your kidneys, the strength of your heart, and the intricate functions of your brain all at once. I am Dr. Amelia Lawson, a dedicated physician with over a decade of extensive clinical experience, specifically focused on the unique health challenges and holistic well-being of adults navigating life beyond the age of 60. Throughout my professional journey, I have had the privilege and responsibility of sitting opposite countless men and women who initially presented with what they perceived as minor, almost insignificant health concerns. Yet, time and again, through careful inquiry and thorough investigation, we would collectively uncover a serious, often deeply entrenched underlying medical condition that had been cunningly concealed behind that one dismissed and seemingly trivial symptom. Morning dry mouth epitomizes precisely this kind of symptom, deceptively straightforward and uncomplicated on the surface, yet holding the potential for truly life-altering consequences beneath. The information I am about to share with you directly challenges a deeply ingrained societal belief that most of us have been subtly, almost unconsciously, conditioned to accept. That discomfort is an inevitable byproduct of aging, and that a dry mouth is simply an unavoidable, unpleasant sensation that accompanies getting older. I wish to be unequivocally direct and honest with you now. That narrative is not the complete truth. After a decade of witnessing patients endure preventable suffering solely because this critical information failed to reach them in time, I am no longer willing to remain silent on this profoundly important subject. If you find this comprehensive overview to be beneficial or illuminating, please consider pressing that like button immediately. Your simple action significantly helps this vital message extend its reach to the individuals who genuinely need to hear it most, potentially transforming their understanding of their own health. Let us now delve deeper into the complex physiological processes that are actually unfolding within your body during those mornings when you awaken with a sensation akin to your mouth being packed with cotton wool. Your mouth relies critically on a continuous, uninterrupted supply of saliva,
and it is imperative to understand that saliva is far more than mere water. It is, in fact, a remarkably sophisticated and dynamic biological fluid, meticulously crafted by your body. This fluid is teeming with a diverse array of essential components, powerful enzymes crucial for the initial stages of digestion, potent antimicrobial proteins that form a crucial defense line against invaders, vital minerals that help maintain dental health, and a complex cocktail of protective compounds. Together, these elements work tirelessly around the clock to defend the integrity of your teeth, the health of your gums, the delicate tissues of your throat, the efficiency of your digestion, and the overall robustness of your immune system. When your salivary glands, those small yet mighty producers of this vital fluid, begin to exhibit a decline in their
Activity, or when other intricate systems throughout the body start to experience duress and struggle, a noticeable and concerning reduction in saliva production inevitably ensues. And when this reduction becomes significant, your mouth becomes noticeably parched, a condition that is particularly pronounced overnight when you are naturally not consuming fluids, not engaging in speech, and not performing any activities that would ordinarily stimulate the natural flow of saliva. After the age of 60, it is a physiological reality that your body's overall saliva production naturally diminishes, yielding roughly 30 to 40% less saliva than it did during your vigorous 40s. This inherent reduction, in and of itself, introduces a real and considerable vulnerability within your oral and systemic health. However, this vulnerability escalates into a genuinely dangerous situation when it converges with any of the 7 underlying causes I am about to meticulously detail. Because none of these causes simply act to dry out your mouth in isolation. Every single one of them serves as a clear, unmistakable indicator, pointing towards a far deeper, more systemic issue quietly manifesting within your body. As a practicing clinician, here is the aspect that compels my greatest concern. Chronic dry mouth is definitively associated with a staggering 45% higher risk of systemic infection in adults over the age of 60. This statistic underscores the profound importance of saliva as your mouth's primary, frontline immune defense. When this vital defense mechanism is compromised or removed, bacteria, fungi, and viruses gain an alarmingly direct and unimpeded pathway into your bloodstream, potentially leading to widespread and serious infections. So, let us now meticulously navigate through all 7 of these significant causes, progressing methodically from those considered least serious to the singular cause that incites the greatest worry and clinical apprehension in my professional judgment. By the time we reach our conclusion, you will possess the precise knowledge of what specific indicators to vigilantly watch for, what pertinent questions and concerns to articulate to your doctor with confidence, and what actionable steps you can fundamentally alter in your routine, commencing as early as tonight, to safeguard your health. Before we embark on this detailed exploration, I wish to pose a deeply personal question to you, the viewer. For how extended a period have you been awakening with this bothersome sensation of a dry mouth? Has it been a mere few weeks, perhaps several unsettling months? Or could it be a persistent experience spanning many years? Please take a moment to share your response candidly in the comments section below this video. I make it a point to personally read every single comment, and your willingness to share your experience not only aids my understanding, but, more importantly, can provide invaluable reassurance and a sense of shared experience to someone else watching this, helping them realize they are unequivocally not alone in facing this challenge. The 7th item on our comprehensive list identifies what I observe to be the most prevalent cause in my clinical practice, and simultaneously, the one that is most frequently dismissed by both patients and often by healthcare providers. This cause is mouth breathing during sleep. Before you prematurely dismiss this point, perhaps thinking it is either self-evident or entirely harmless, I implore you to internalize a crucially important distinction. Mouth breathing during sleep is, in almost every clinical scenario, never merely an isolated benign habit. In my extensive clinical experience, it consistently serves as a telltale symptom, an underlying indicator of something more significant occurring within the body. And this nuanced distinction holds immense importance for accurate diagnosis and effective intervention. When you respire through your mouth throughout the nocturnal hours, there is a continuous current of air that flows directly across the delicate surfaces of your tongue, the intricate architecture of your palate, and the sensitive tissues at the very back of your throat. This unceasing airflow relentlessly evaporates the vital moisture from these oral surfaces at a rate that your salivary glands are simply incapable of matching or compensating for while you are in a state of sleep. The inevitable consequence of this physiological imbalance is that distinctly unpleasant sandpaper-like sensation that greets you upon waking, often accompanied by painfully cracked lips, a tongue that feels uncharacteristically thick or heavily coated, and occasionally a sore throat that bears no relation whatsoever to an actual illness or infection. But here lies the profound aspect that elevates my concern far beyond the immediate discomfort of a dry mouth itself. Mouth breathing during sleep is very often, and indeed frequently, instigated or exacerbated by underlying conditions such as chronic nasal congestion, anatomical irregularities like a deviated septum, obstructive nasal polyps, or, most critically, undiagnosed or untreated sleep apnea. And sleep apnea in particular is not merely a minor inconvenience to be casually dismissed. Extensive and rigorous research conclusively demonstrates that untreated sleep apnea is directly correlated with staggering 60% increased risk of suffering a stroke and a deeply concerning 40% increased risk of developing heart failure. Therefore, if you consistently awaken with a parched mouth, and you also exhibit other related symptoms, such as loud snoring, a persistent feeling of being unrested even after what you perceive as a full night's sleep, or if a partner or close family member has observed instances where you momentarily cease breathing during the night, I implore you, please do not simply relegate these observations to the category of just the way I sleep. This is a critical opportunity for intervention. Instead, initiate an urgent conversation with your primary care physician about the possibility of undergoing a comprehensive sleep study. That single, proactive conversation has the potential to hold far more significance for your long-term health than you can currently fathom. For individuals whose nocturnal mouth breathing is not intrinsically linked to the more serious condition of sleep apnea, the practical and accessible solutions are generally straightforward, highly effective, and can yield rapid improvements. Employing a simple nasal strip, strategically placed across the bridge of your nose before retiring for the night, can significantly enhance nasal airflow, thereby gently encouraging your body to revert to the natural, intended method of nasal breathing. Maintaining a humidifier in your bedroom, with its humidity level consistently set between a comfortable 40 and 50%, has been shown to dramatically mitigate overnight moisture loss from the oral cavity. Adopting a side sleeping position, rather than sleeping on your back, is another simple, yet effective behavioral modification that can substantially reduce the propensity to breathe through your mouth. Furthermore, a small strip of specialized surgical tape delicately placed vertically over the lips before sleep, a technique routinely employed and endorsed by sleep specialists for many years, serves to gently and effectively retrain chronic mouth breathers back towards the more beneficial practice of nasal breathing. Many individuals who adopt these simple interventions report noticing a genuinely significant and positive difference within the very first week of implementation, experiencing greater comfort and improved oral health upon waking. The sixth pervasive mistake I consistently observe in my clinical practice is one that, on the surface, appears entirely logical and intuitive until one gains a deeper understanding of the precise physiological reasons why it fundamentally fails to achieve the desired outcome. The vast majority of individuals who habitually awaken with a dry mouth instinctively operate under the assumption that the remedial action is straightforward. Simply consume a greater quantity of water immediately before retiring to bed. And so, with good intentions, they do precisely that. They conscientiously finish a large, refreshing glass of water just moments before extinguishing the bedside lamp,
only to awaken the following morning with a mouth feeling just as parched and uncomfortable as before. Sometimes this repeated experience leads to even greater frustration, as they feel they have diligently followed all the correct advice, yet nothing is tangibly improved. Herein lies the critical explanation. Your body does not absorb and utilize hydration in real time, like an immediate sponge. When you ingest water, it typically requires a period ranging from approximately 30 minutes to a full 2 hours for that fluid to be properly absorbed from
Your digestive tract, efficiently distributed throughout your various tissues, and subsequently made available for crucial physiological functions, such as the production of saliva. Consequently, water consumed at, for instance, 10 at night will exert very little, if any, beneficial effect on the hydration status of your oral cavity by 6 the following morning. The optimal window for that specific hydration to impact overnight oral moisture has, by then, already long closed. The true underlying issue, therefore, is not what transpired or failed to transpire in the immediate moments before sleep, but rather what happened, or more accurately, what didn't happen during the preceding afternoon hours. Groundbreaking research has definitively established that adults over the age of 60 who failed to maintain adequate and consistent fluid intake between the critical hours of noon and 4 in the afternoon were a striking 62% more likely to experience significant and problematic overnight dry mouth when compared directly to their counterparts who meticulously remained consistently hydrated throughout the entire day. A 62% difference is not merely a subtle variation. It represents a profoundly substantial divergence in health outcomes. After reaching the age of 60, managing this essential hydration balance naturally becomes an even greater challenge, largely because the body's intricate thirst mechanism, which serves as our internal hydration gauge, becomes genuinely less reliable and less sensitive with advancing age. It is entirely possible for an individual to be meaningfully dehydrated at this stage of life and yet experience no particular or compelling urge to drink water whatsoever, completely missing the body's subtle cues. Furthermore, many individuals also, quite understandably, consciously reduce their afternoon fluid intake with the legitimate aim of minimizing inconvenient nighttime bathroom trips. While this decision is completely comprehensible from a lifestyle perspective, it inadvertently creates a significant hydration deficit that peaks precisely during the nocturnal hours when you are asleep, and consequently have no practical means of actively correcting it. The effective solution, therefore, is emphatically not to consume more water right before bed. Instead, the strategic approach involves front-loading your hydration efforts much earlier in the day. A practical and highly recommended target is to aim for a sustained intake of 6 to 8 ounces of water with every single meal, and crucially, with every afternoon snack. And here is a small, yet remarkably effective, professional tip that can further enhance your hydration strategy. Consider adding a tiny pinch of high-quality sea salt and a generous squeeze of fresh lemon juice to your afternoon water. This simple addition actively supports optimal electrolyte balance within your body, a critical factor that helps your cells effectively retain the fluid you consume, rather than allowing it to merely pass straight through your system, maximizing its beneficial impact. Number 5 on our illuminating list is a cause that has the propensity to catch almost everyone completely off guard, primarily because we seldom associate the intricate world of nutrition as a direct and immediate causal factor for something as seemingly localized as a persistent dry sensation in your mouth every single morning. Your salivary glands, those small but incredibly vital structures, are far from being passive or inert components of your oral anatomy. On the contrary, they are remarkably, metabolically active tissues, constantly engaged in complex biological processes that demand a precise and continuous supply of specific, essential nutrients to function optimally at the foundational cellular level. In adults over the age of 60, two particular nutritional deficiencies stand out as having an exceptionally detrimental impact, tearing through salivary gland function with alarming speed and severity, often faster than almost anything else. The first of these critical nutrients is vitamin A. This fat-soluble vitamin is absolutely indispensable for maintaining the robust health, structural integrity, and proper functionality of every single mucous membrane throughout your entire body. This extensive network includes the delicate lining of your mouth, the protective tissues of your throat, the intricate passages within your nasal cavity, and the vast expanse of your digestive tract. When the body's stores and circulating levels of vitamin A begin to fall below optimal thresholds, these crucial mucous membranes become progressively thinner, noticeably drier, and increasingly less functional, severely impairing their protective and secretory roles. Compelling research has illuminated this connection, demonstrating that adults over the age of 60 who presented with clinically low vitamin A levels exhibited a substantial 41% reduction in their resting saliva production when directly compared to individuals with adequate, healthy levels of this vitamin. This is not a subtle or negligible effect. It represents a profound compromise, signifying that your salivary glands are effectively operating on a mere fraction of their inherent capacity, struggling to perform their essential functions. The second category of vital nutrients encompasses the B vitamins, with specific emphasis placed on vitamin B3, commonly known as niacin, and vitamin B12. A deficiency in niacin directly and significantly disrupts the intricate nervous system signals that are responsible for initiating and stimulating saliva production in the first place, effectively cutting off the communication pathway. Concurrently, a deficiency in vitamin B12 is a well-documented cause of the tongue becoming inflamed, abnormally smooth in appearance, and persistently dry, a distinctive and often uncomfortable condition clinically referred to as glossitis. When these two B vitamin deficiencies converge, they collectively create a severe and intractable dry mouth condition that no amount of water, however conscientiously consumed, will be able to fully resolve. This is because the fundamental problem does not stem from simple dehydration. Rather, it originates from a more profound impairment at the level of cellular function, where the very machinery for saliva production is compromised. After the age of 60, the body's ability to absorb vitamin B12 from dietary sources significantly diminishes, largely due to a natural reduction in the production of stomach acid, which is essential for its release from food proteins. Research strongly indicates that up to a staggering 30% of older adults may possess inadequate levels of vitamin B12 without any conscious awareness of this critical deficiency whatsoever. To address these nutritional needs through dietary intake, focus on incorporating foods rich in vitamin A, such as vibrant sweet potatoes, nutrient-dense dark leafy greens, and eggs. For vitamin B12, prioritize lean meats, various types of fish, and dairy products. However, for a substantial number of adults over 60, dietary intake alone may not suffice, necessitating the strategic use of supplementation to achieve optimal levels. When seeking a B-complex supplement, it is advisable to look for one that contains at least 1,000 micrograms of B12 in the methylcobalamin form, which is recognized as the most bioavailable and readily utilized version of the vitamin. And for one more practical and highly effective professional tip, remember that vitamin A is a fat-soluble nutrient, meaning its absorption is dramatically enhanced when it is consumed concurrently with a small amount of healthy fat. Incorporating a light drizzle of high-quality olive oil over your vegetables or adding a few slices of fresh avocado to your meal can make a genuine and significant difference in the bioavailability of this crucial vitamin, optimizing its impact on your salivary gland health and overall well-being. Number 4 represents a clinical combination that I approach with the utmost seriousness and vigilance in my medical practice. If the circumstances I am about to describe resonate with your own experience, I implore you to hear this information with absolute clarity, not with an immediate sense of fear or panic, but rather with the empowering understanding that recognizing and addressing these signs early is genuinely paramount and can make all the difference. If you are consistently awakening with a noticeably dry mouth, And concurrently, you find yourself needing to get up to urinate more than once during the nocturnal hours. That specific pairing of symptoms constitutes a profound clinical warning flag that I, as a physician, simply cannot and will not ignore. When these two seemingly disparate symptoms manifest together, they are among the earliest, most subtle, yet incredibly significant indicators of potentially uncontrolled blood sugar levels. And, in a substantial number of cases, they serve as the quiet heralds of an undiagnosed or unrecognized type 2 diabetes. Let me elucidate the underlying physiological mechanism. When blood sugar concentrations within the body ascend above a specific, healthy threshold, your kidneys, those diligent filtration organs, are compelled to work in overdrive. Their strenuous task becomes to filter and excrete the excess glucose from your bloodstream. To accomplish this demanding process, they are forced to draw substantial amounts of water from the body's various tissues, in essence, siphoning internal fluid. This internal fluid loss, which often goes unnoticed in its initial stages, leads to a pervasive dehydration that originates from the inside out. One of the very first and most palpable places you will experience this profound internal dehydration is, paradoxically, in your mouth overnight, precisely when there is nothing you can actively do to compensate for or mitigate this fluid deficit. What renders this particular diagnostic insight so critically important is the often protracted timeline involved. Extensive research has starkly revealed that morning dry mouth was a symptom reported by a significant 63% of adults who were newly diagnosed with type 2 diabetes. Even more concerning, the majority of these individuals had been experiencing this very symptom for a period exceeding an entire year prior to their formal diagnosis. This translates to over a year during which their body was sending a clear, repetitive signal that something was profoundly amiss every single morning, yet this signal remained largely uninterpreted or dismissed. I am often reminded of a specific patient in my practice, a retired woman in her early 70s, whose intellect remained remarkably sharp and who maintained an active lifestyle. She initially came to me for an entirely unrelated health concern. As she was preparing to leave, almost as a casual afterthought, she briefly mentioned the nuisance of her dry mouth. Prompted by this seemingly minor detail, I asked a few targeted, probing questions. Was she consistently waking up at night to use the bathroom? Her affirmative response confirmed a regular occurrence. Had she noticed any unusual or persistent fatigue in the afternoon hours? Again, a clear yes. These seemingly minor details, when woven together, painted a clearer picture. I immediately ordered a fasting blood glucose panel for her that very same week. Her result came back at an alarming 148 milligrams per deciliter, a definitive indicator of elevated blood sugar. She had, unknowingly, been living with type 2 diabetes for well over a year, with her body trying to communicate its distress through these subtle symptoms. Within a remarkably short span of 4 months, through carefully targeted dietary adjustments, consistent daily movement, and strategic supplementation with compounds like berberine and magnesium glycinate, her fasting glucose levels had gracefully normalized. At her follow-up appointment, she shared with me, with genuine relief, "I finally feel like my body is working with me again, not against me." That, truly, is the profound impact of catching something early. It is not an impending crisis. It is a precious opportunity to reclaim and restore one's health, transforming a potential long-term struggle into a manageable and reversible condition. Number 3 on our comprehensive list identifies a challenging autoimmune condition that currently impacts approximately 4 million Americans, a substantial number that often goes unrecognized. Yet, despite its prevalence, the average patient suffering from this condition endures an agonizing waiting period of nearly 3 years, from the very moment their initial symptoms begin to manifest to the eventual moment they finally receive a correct and definitive diagnosis. 3 years. This extended delay is not merely an unfortunate gap in medical knowledge or a deficiency in available diagnostic tools.
It represents a profound systemic gap in the critical conversations that are, or rather are not, consistently happening inside examination rooms across the country. The condition in question is named Sjogren's syndrome. It is a chronic autoimmune disorder, meaning that the body's own immune system, which is typically designed to protect against external threats, mistakenly turns inward and launches an attack against its own healthy tissues. Specifically, in Sjogren's, the immune system targets and damages the body's moisture-producing glands, with primary aggression directed towards the salivary glands, responsible for oral moisture, and the tear glands, responsible for ocular lubrication. The direct consequence of this relentless autoimmune assault is a constellation of highly uncomfortable and persistent symptoms: an unremitting dry mouth that no amount of water seems to alleviate, chronic dry eyes that often feel gritty, itchy, or burning, and an increasing difficulty with the act of swallowing due to the lack of adequate lubrication in the throat. In more advanced and severe cases, Sjogren's syndrome can progress to systemic involvement, extending its damaging effects beyond the glands and manifesting as widespread joint pain, debilitating fatigue that severely impacts quality of life, and even affecting vital internal organs such as the kidneys and the lungs. It is particularly noteworthy that women over the age of 60 are disproportionately affected by Sjogren's syndrome, representing a staggering nearly 90% of all diagnosed cases, highlighting a clear demographic vulnerability. So, why then does it take such an unacceptably long time to accurately identify and diagnose this prevalent condition? The fundamental reason lies in the fragmented approach often taken in healthcare. Each individual symptom tends to be treated in isolation, as if it were an independent problem. The persistent dry mouth is routinely dismissed as an unavoidable aspect of aging or attributed to simple dehydration. The chronic dry eyes are often explained away as a consequence of excessive screen time or misdiagnosed as seasonal allergies. The joint pain, when it appears, is typically labeled as common arthritis, failing to connect it to a broader systemic issue. Crucially, no single doctor typically connects all these seemingly disparate dots, and as a result, the underlying autoimmune process continues its unchecked and insidious progression throughout this entire period, causing further damage. The critical diagnostic clue that I want to empower you to carry with you and to proactively discuss with your healthcare provider is this: if your chronic dry mouth is consistently and persistently accompanied by eyes that feel profoundly dry, uncomfortably gritty, or experience a persistent burning sensation, and most especially if you are a woman over 60, please, for the sake of your health, specifically ask your doctor about Sjogren's syndrome by name. Requesting this by name can often bypass delays. A simple blood test, which specifically measures the presence and levels of two particular antibodies, anti-SSA, also known as Rho, and anti-SSB, also known as La, can effectively identify the presence of this condition in the vast majority of cases. You have an absolute right as a patient to request this specific test. Do not passively wait for someone to eventually offer it to you. Advocate for yourself and ask. While there is currently no definitive cure for Sjogren's syndrome, there are numerous effective treatments available that can significantly manage the often debilitating symptoms and, crucially, slow down the progression of the disease, preserving organ function and improving quality of life. And for immediate, temporary relief while you are actively seeking definitive answers and diagnosis, sugar-free gum containing xylitol is one of the most accessible and beneficial tools available without requiring a prescription. It works on two fronts. It powerfully stimulates the natural production of saliva, thereby moistening the mouth, and simultaneously actively inhibits the growth of decay-causing bacteria, which are notoriously encouraged and exacerbated by the dry mouth environment. Number 2 on our critical list presents a connection that the vast majority of people would never intuitively link to a seemingly isolated symptom like a dry mouth. However, the connection is undeniably real. It is meticulously documented by extensive scientific research, and it is a piece of vital information that every adult over the age of 60 absolutely deserves to be aware of and understand. Your salivary glands, those small organs diligently producing oral moisture, do not function as independent, isolated entities. Rather, their complex activity is intricately governed and regulated by the overarching autonomic nervous system. More specifically, they fall under the purview of the parasympathetic branch of this system, which is the
Crucial division responsible for overseeing the body's essential rest and digest functions, promoting recovery, relaxation, and efficient digestive processes. When this intricate and delicate system, the autonomic nervous system, begins to show signs of compromise or dysfunction, a noticeable decline in salivary activity often ensues, leading inevitably to the sensation of the mouth drying out. What makes this particular insight so profoundly significant and clinically relevant is the established fact that autonomic nervous system dysfunction is a widely recognized and often early feature of serious neurodegenerative conditions, such as Parkinson's disease and Lewy body dementia. Groundbreaking research has definitively shown that these subtle yet distinct autonomic changes, including alterations in salivary gland function, can manifest an astonishing 4 to 6 years before the appearance of the classical motor symptoms, such as tremors, rigidity, and bradykinesia, that typically lead to the eventual diagnosis of these debilitating neurological disorders. This extended preclinical window offers a unique and invaluable opportunity for early detection and intervention. I recall distinctly a patient in my practice, a retired man in his late 70s, who possessed a methodical nature and a quietly observant disposition. Over the course of several visits, he had consistently mentioned a persistent dry mouth as a minor, bothersome complaint. We had diligently worked through all the obvious and common explanations, carefully reviewing his medication list, optimizing his sleep position, and ensuring his hydration levels were adequate. Yet, despite these efforts, nothing seemed to fully resolve his persistent dryness. Then, during one particular appointment, his wife casually mentioned, almost in passing, that he had gradually stopped recognizing the familiar and comforting aroma of his morning coffee. He himself had noticed this curious change, but assuming it was an unrelated and insignificant detail of aging, he had chosen not to bring it up. However, it was far from unrelated. This seemingly minor detail, combined with the persistent dry mouth, triggered an immediate and serious concern in my mind. I promptly referred him to a neurologist for further evaluation. Comprehensive imaging and neurological assessments subsequently confirmed an early diagnosis of Parkinson's disease. Understandably, he and his wife were profoundly shaken by the news, but crucially, because we had identified the condition at such an early stage, he was able to immediately commence neuroprotective therapy and, perhaps even more importantly, collaborate with his care team to construct a comprehensive care plan well in advance of the development of significant and debilitating motor symptoms. 3 years later, his quality of life remains genuinely good, a testament to the power of early detection and proactive management. At a recent visit, he reflected, "I almost didn't mention the dry mouth. I thought it was too small, too trivial to bring up to you." This sentiment underscores a fundamental truth. Nothing about your body's communication is too small or insignificant to bring up to your doctor. Your body is perpetually communicating with you, sending signals and messages about its internal state, both subtle and overt. Our collective responsibility, yours as the patient and mine as the clinician, is to cultivate the awareness and learn how to truly listen to these profound biological messages. And finally, at the apex of our list, number 1, lies the single most frequent cause of chronic dry mouth that I encounter in my medical practice. It is, simultaneously, the cause that is most consistently overlooked, most inadequately communicated between patients and healthcare providers, and, in my considered professional opinion, the one most profoundly deserving of a direct, honest, and transparent conversation. The astonishing reality is that over 500 commonly prescribed medications across various therapeutic classes list dry mouth as a documented side effect. Over 500 unique pharmacological agents.
For adults over the age of 60, who, on average, are often managing multiple health conditions and consequently taking 5 or more prescription medications daily, the cumulative impact of these drugs on both salivary gland function and, even more critically, on their long-term brain health can be nothing short of profound and deeply concerning. The drug classes most frequently identified as being responsible for inducing or exacerbating dry mouth include widely used medications such as antihistamines, various types of antidepressants, a broad spectrum of blood pressure medications, bladder medications aimed at controlling urinary frequency, certain antipsychotics, and a range of pain medications, including often prescribed muscle relaxants. What elevates this particular cause beyond mere discomfort and into the realm of genuine danger is a complex yet crucial concept known as anticholinergic burden. This refers to the cumulative neurological effect exerted by multiple medications that collectively act to block the activity of acetylcholine, which is a pivotal and essential neurotransmitter involved in a vast array of bodily functions, including learning, memory, and salivary production. High anticholinergic burden has been consistently and unequivocally linked in multiple large-scale, robust scientific studies to accelerated cognitive decline and a significantly elevated risk of developing dementia. The persistent dry mouth in this context is not merely an unpleasant endpoint symptom, it is a critical, visible physiological signal, a red flag alerting us to a more profound and potentially damaging process occurring much deeper within the body, particularly affecting neurological function. I vividly recall a patient, a retired gentleman in his mid-70s, who came to me describing the deeply uncomfortable sensation of waking up every single morning feeling as though he had swallowed chalk. He had been on the same combination of multiple medications for years, prescribed over time by various specialists, none of whom had ever collectively reviewed his full medication list in its entirety to assess potential interactions or cumulative effects. Through a meticulous medication reconciliation process, we were able to identify 2 specific drugs he was taking that possessed overlapping and compounding anticholinergic effects, both of which, thankfully, had equally effective yet safer alternatives available. We proceeded with 2 strategic medication substitutions, carefully tapering off the problematic drugs and introducing the alternatives. Within a matter of weeks, he began to notice a tangible difference in his oral comfort. Within 2 months, he reported back to me, with a remarkable sense of relief and renewed vitality, I wake up feeling like a normal person again, and my thinking feels sharper, clearer than it has in years. This dramatic improvement was unequivocally not a mere coincidence. It was a direct and profound consequence of addressing the underlying anticholinergic burden. Here, then, is your actionable plan, a concrete set of steps you can initiate, starting as early as tonight, to take charge of your oral health and potentially much more. Firstly, immediately cease the use of any over-the-counter sleep aid that contains diphenhydramine, a common anticholinergic ingredient. Instead, consider using a much gentler and natural alternative like melatonin, starting with a low dose of 0.5 to 1 milligram to support healthy sleep cycles without the drying side effects. Secondly, ensure you operate a humidifier in your bedroom, maintaining the humidity levels consistently between 40 and 50%, which will significantly reduce overnight moisture loss. Thirdly, actively front-load your hydration throughout the afternoon, focusing on consistent fluid intake between noon and 4 p.m. as discussed, rather than attempting to compensate right before bed. Fourthly, make it a habit to brush your teeth with a fluoride toothpaste specifically formulated for dry mouth before you retire for the night, providing crucial protection against increased decay risk. And finally, try incorporating a simple nasal strip tonight to encourage nasal breathing. Beyond these immediate steps, this week, commit to writing down a comprehensive list of every single medication you currently take, including prescriptions, over-the-counter drugs, and supplements.
Bring this meticulously compiled list to your doctor during your next appointment. Initiate a direct and assertive conversation by asking, "Do any of these medications suppress saliva production? And if so, are there any equally effective, safer alternatives available that could reduce this side effect or the overall anticholinergic burden?" It is imperative to understand that you are not broken. Your situation is not a personal failure. Rather, your information regarding these crucial connections has simply been incomplete. And starting right now, with this newfound knowledge, that fundamentally changes. If you found this extensive video and detailed explanation genuinely helpful and enlightening, please do not hesitate to smash that like button. Consider subscribing to this channel for a continuous stream of real, evidence-based health solutions, thoughtfully built and specifically tailored for adults navigating life over the age of 60. Most importantly, share this invaluable information with someone you genuinely care about. A dear friend, a beloved family member, a spouse. Your simple act of sharing may just provide them with that singular, pivotal piece of information that has the power to change everything about their health trajectory. And finally, I am eager to hear directly from you. Which of these 7 causes surprised you the most, prompting a deeper reconsideration of your own health? Which one resonated so strongly that it made you instinctively think, "That might be me"? Please share your insights and personal reflections candidly in the comments section below. I truly and sincerely want to know your story, as it helps all of us learn and grow. Because always remember this profound truth. Aging itself does not diminish or take away your body's inherent ability to heal and recover. It simply serves as a powerful and persistent reminder that you must care for it in the most informed and correct way possible. Take meticulous care of yourself and empower yourself with knowledge.